Hello everyone, welcome back to channel Alpha Doctors, and today we are going to study about the anatomy of the wrist region. So the wrist region, as you can see in the diagram here, this region is known as the wrist region, and it is composed of 8 different types of carpal bones. These carpal bones are small bones that have independent blood supply, and they form the most of the portion of the wrist and giving the function of mobility and performing different functions. So the most important thing to remember is that these carpal bones are basically aligned in two rows. One row is the upper row and one row is the lower row, and there are four carpal bones in each of the row. These carpal bones are basically scaphoid, lunate, trichotram, pisiform, hamate, capitate, trapezoid, and trapezium. So here is also mnemonic present for your ease that the first letter is provided. The mnemonic goes so long to pinky. Here comes a thumb. So this is basically a mnemonic to remember the names of the bones, that is scaphoid, lunate, trichotram, pisiform, hamate, capitate, trapezoid, and trapezium. So the scaphoid is palpable in the anatomical snuff box, and it is the most common fractured carpal bone. This is an important point to remember with the perspective of USMLE, that the scaphoid is the most commonly fractured carpal bone, and typically due to a fall on an outstretched hand, for example in children while playing, or in adults during RTA, etc. The complications of flexible scaphoid fractures include avascular necrosis and non-union due to retrograde blood supply from a branch of the radial artery. So this is an important consideration to remember while dealing with the fractures of the scaphoid bone, that there is a common complication of avascular necrosis and non-union. The occult fractures are not always seen on initial X-ray. For example, if a person falls on outstretched hand and you do his X-ray, you will not see any fracture at that moment. However, if you repeat the X-ray after 2 weeks, you can see a proper fracture. So it is important to remember this while dealing with these fractures, that you need to repeat the X-ray if you're suspecting a scaphoid fracture. Then the dislocation of lunate is the second most common pathology of the wrist region involving the carpal bones. So the lunate can be dislocated and it can impinge on the median nerve and result in a carpal tunnel syndrome. So the carpal tunnel syndrome is basically a syndrome that is due to involvement of the median nerve, compression of the median nerve as it passes through this channel of the wrist region. So in this region, we saw that the lower portion is formed by the carpal bones, and on top we have a ligament that is known as the flexor retinaculum or the transverse carpal ligament. This provides stability, and it provides basically a anatomical location to pass the structures through. If there is a compression of median nerve while passing through this boundary hole, this will result in the carpal tunnel syndrome. And the symptoms of tunnel syndrome include the wasting of the muscles, wasting of the thin arm muscles. There can be paresthesias, numbness, and different types of symptoms that we will study in our pathology section. So this was all about the anatomy of the wrist region. If you have any questions, you can ask in the comment box. Thank you.